Welcome to the Envision Lecture series. We are so excited for today's fireside chat on social care innovation. My name is Jonathan Haag, and I am Vice President of Innovation at CICOA Aging and In-Home Solutions. CICOA is the area agency on aging for Central Indiana. I like to describe my work as walking alongside colleagues, exciting their imaginations, and helping develop ways of expressing sparks of inspiration. And so my experience has led me to partner with subject matter experts to co-create advantaged innovation. And my background intertwines strategy, product design, service design, and innovation within for-profits and nonprofits. So a little bit of housekeeping on this webinar. The one thing that I wanted to make sure everybody was aware of is we will have a time for Q&A at the end, and we will use the chat feature for that. So we have a colleague here that will monitor that chat throughout the meeting, start to bring some of those common questions together for Abby and I to address at the end of the webinar. So before we explore what innovation looks like on the ground, I want to begin with a broader systems perspective. An anthem plays an important role in shaping the social care landscape nationally. I'm very excited to introduce my friend, my former colleague, and my always collaborator, uh, Dustin Ziegler, to share a special message from our title sponsor, Anthem. Dustin is currently a director with the Anthem Pathways for Aging program in Indiana, serving individuals age 60 and over, as well as their caregivers who are on the Pathways program. Dustin was the first hire for the Anthem Pathways program, joining the company back in January of 2023. Before joining Anthem, Dustin was Vice President of Clinical Engagement at CICOA. In this role, he led various initiatives to partner with health and hospital systems in Central Indiana to integrate the social care services and supports that CICOA offered into clinical care models, thus merging clinical and social care into optimized health outcomes for those CICOA served. I'm really grateful to have you here today, Dustin. Would you mind taking a few minutes to talk about Anthem and its role in collaborating with and amplifying social care innovation?
Yeah, of course, and thank you. And it's so great to be back too. This is kind of cool, gone full circle. I feel like I'm kind of back home a little bit too. So it's great to see you all. Um, I think I'll start off just a couple of minutes, and as Jonathan mentioned, I'm with Anthem right now with the Pathways program. Healthcare is evolving rapidly, and we have to remain lockstep with the innovation to keep up with that rapid evolvement. And by we, I mean community-based organizations like CICOA, companies like Anthem, healthcare systems. It's constantly moving, and innovation is just crucial for us and the work that we do, and obviously for the health and wellness of the patient populations that we all serve at any age, really, both preventatively and for those who are suffering with, say, chronic conditions and things like that. So when I first and foremost think about innovation within the healthcare space, as Jonathan mentioned, and he's heard this ad nausea for 10 years from me, but I do believe, and that's what we really focused on, and now more than ever, when we think about healthcare, we've always traditionally thought about the clinical side, clinical settings, the four walls of a doctor's office, medications, procedures, and that is obviously highly crucial in healthcare, but that's about 20% of it. And the way we really optimize this is integrating that clinical side with what we're calling the social care side. And when you bring those two worlds together, that's where you maximize health and wellness and patient outcomes. Um, as my CICOA friends have heard for a long time, I've used the analogy you can have the best doctor in the world, prescribe the best medication in the world, everything in between. But when you leave that doctor's office, do you have access to the pharmacy? Did you have transportation to even get to the doctor's office? Does your caregiver have the support that they need to be the best caregiver and proficient caregiver for you? You know, it just goes on, and that's where the social care component intertwines with the clinical care component. That's what we've always been focused on, and that's what we continue to focus on at Anthem. Just to speak of our approach too, it's very aligned with the same concept. We focus highly on community collaboration, on partnerships, aligning ourselves and the folks that we serve in Indiana and across the country with localized community folks who are the experts in their area. Not one person can be the expert in everything, but we're very focused on that community collaboration as an emphasis around social care. And we also know that communities aren't, two communities aren't always the same. What works in one could be very different in the other. So we take a very strategic and concentrated approach to those considerations. Just to spit off a couple, I mean, just within Anthem, just since we've launched our Pathways program, I can think of, Joy's House, CICOA. We help CICOA and Dementia Friends deliver some memory cafes. We're working with Department of Homeland Security, and first responders. It's just really the Alzheimer's Association. And it goes on and on. And so I think that's my message to kind of kick things off when it comes to social care. These are the things that really, really matter, and the models that we at Anthem focus on, that I know that CICOA focuses on, and I'm really looking forward to the conversation, Jonathan. And I appreciate the time to share some info, and it's always amazing to see you, my friend.
Dustin, thank you. Thank you so much for being here, for those words. We're going to take you out of the spotlight for a minute, but
Oh,
that doesn't change our love and respect for you,
fair.
Dustin, and for Anthem. I just want to reiterate our thanks to Anthem for supporting the Envision Lecture series for this entire year. So, Dustin, thank you. Look forward to you popping into the Q&A, which I'm sure you will contribute mightily to.
Thank you.
Yes, thank you. All right. So 2 years ago, I was introduced to Abby Morgan, and Abby is the CEO of Direction Home Akron Canton. And Abby has spent her career in the aging network, and her experience spans local, state, and federal levels. Before leading Direction Home, she held roles at U.S. Aging, the Administration for Community Living, and the Centers for Medicare and Medicaid Services. She is a national speaker on community integrated health networks and has worked closely with area agencies on aging across the country. And that vantage point gives her a unique perspective on where the field has been and where it's going. And at the same time, Direction Home, much like CICOA, has been serving older adults and people with disabilities for more than 50 years. It is deeply rooted in community with a person-centered approach and a broad provider network that ensures people can thrive in the places they want to call home. And so with that, we're going to transition to the fireside chat. And we're so grateful to have you all here and let you listen in to this conversation and contribute to it through the chat, and then continue the conversation after this. So, Abby, I thought we could start here. And that is kind of finding out, how did each of us and our organizations find ourselves even talking about innovation and now occupying this innovation space? Was it deliberate strategy? Was it lived necessity, or something else entirely? So I'll let you start on that.
Or is it all of the above? I chuckle when you say it's been 2 years that we've been having these conversations, and sometimes it feels like time flies by. But I always get something out of our conversation. So I'm honored to be able to be here. And I know we prepared and collaborated on this session, but I also have my pen and my notebook because I know that I'm going to get something out of our conversation. I always do. Um, you know, from a personal perspective and thinking about how I came to this work, it was an interesting time when I joined the Aging Network, because it was right between when Medicare modernization happened and we added Medicare Part D to the Medicare benefit, and several years later the Affordable Care Act passed. So in between all of that, there started to be a lot of conversations around what is the role of healthcare in supporting and wrapping around in community services and vice versa. And I think we saw a lot of that as these big healthcare initiatives rolled out. There was this natural leaning into community organizations and how are they close to and part of engaging people and part of the solution. So it was kind of a very unique time period for me to come in and then look at this and say, there's tremendous opportunity here. As a member of the Aging Network and an area agency on aging, I think that our founding legislation in the Older Americans Act is a beautiful foundation for being that partner. But it's just that it's a foundation. That act is not grown significantly. It's not expanded upwards to support us. So there's tremendous opportunity in those partnerships. But innovation can be a scary word, and I think we're still trying to address people when they say, I don't know what innovation means or how I do that. We don't do that. But I think it's getting paid for all the things that we have done alongside in partnership or wrapped around healthcare. The things we did during COVID, something else entirely that we haven't thought about yet. Innovation can be approachable from all of those lenses.
Abby, I really appreciate that point, speaking to the broad spectrum of what innovation means to any type of organization. And I think that's why we kind of landed on this in our first question, because there is lots of different paths to get here. And so for me here at CICOA, the way we entered this space was really from a process improvement lens, right?
Yeah.
Which is something that, I know we have talked about a little bit, but we as an organization, and this really started for us 7 years ago, and we had some intentional effort in our community-based organization to say, hey, we want to improve processes, right? We are at the time nearing a 50-year-old organization and now are a 50-year-old organization. And we've done a lot of the same things that we've done throughout that whole history. And so the leadership at the time put forth this what became staff committee-led process improvement activity. And part of my role, because I raise my hand a lot, Abby, and I'll say, yes, I want to participate in that. And so I joined that committee and voted on by my peers to lead that committee. I don't think anyone else wanted to, but because it was kind of a difficult thing, because we were trying to take Lean, Six Sigma, all of these great process improvement activities that don't show up a lot in the nonprofit space, right? And um, don't show up in a lot of community-based organizations. And I definitely noticed that among my colleagues of the words that we were using, like let's run a Kaizen event, right? And let's do all that. It was not accessible to our staff. And so we really took this approach to say, we want to do process improvement, absolutely. But let's take how we're talking about this and create some accessibility to it. And so that's where we took elements of human-centered design and design thinking. So these are our concepts from really great and smart people and organizations, but not often applied to the nonprofit space. So what we merged together was Lean Six Sigma principles with what we call our innovation journey, which is ideation, prototyping, iterating, and implementing. And here's the cool thing about this, Abby, and we've talked about this before, that ideation, prototyping, iterating, launching, that is the basis of Lean Six Sigma. It is the basis of process improvement, but it's also the basis for creating new, like what some people think in the biggest terms of innovation, these are the foundational elements of that. And so we feel like we unlocked a little bit of a superpower when we first started trying that out. And I know we're going to have lots of time to talk about this throughout the webinar, so I won't share all the secrets yet. But what we found was we applied that mindset to some process improvement activities that really broadened our scope of what innovation meant. It was both process improvement for us, but it was also new service, new product creation. And so we created a repeatable framework called Wrinkle Innovation to then accomplish that. So that's a little bit of how we found ourselves in the space with all of the trends that you were talking about as well, and that Dustin illustrated in his underpin how we show up through those things. So we are going to transition. I think everyone in the group kind of saw the layout of the discussion, that we have kind of 5 areas that we're looking to respond to prompts in. And that first area that we're going to talk about is proximity as a catalyst for social care innovation. And really, if vision sets direction, then proximity shapes insight. And the organizations closest to the people we serve often see needs and solutions long before they appear in policy briefs and board meetings. I'll say this another way. Community-based organizations operate at human speed. We are in homes. We are in neighborhoods. We sit with caregivers. We hear frustration before it becomes data. And to highlight, proximity is not just physical closeness, it is relational trust, right? It creates pattern recognition that cannot be replicated from a distance. It also creates urgency. When you see the impact of fragmentation every day, innovation becomes less about theory, right? And more about necessity. This conversation that we're going to have invites us to consider how proximity gives CBOs a distinct advantage in identifying practical, scalable solutions, and how larger systems, partners, can engage in that wisdom. So, Abby, let's start with this prompt. What is something you and your organization saw early because you were close to the community?
So, even borrowing from, the last thought process, where innovation can kind of seem scary, like a big word, like I can't define that, or I don't know exactly what that looks like. When we're thinking about this proximity or closeness to what we see, it also feels a little bit more practical or attainable innovation when we're thinking about, well, what are we seeing every day? And then, how are we responding to that? And so I would say an example that we've had in recent history is our journey into programs and supporting digital navigation and online access to people in the community. So early on in the pandemic, we were thinking about how are we reaching people who are staying at home? And knew and understood that there were significant barriers to accessing devices in the homes. We knew we had a large population of people who only had access to smartphones, had never had Wi-Fi in their homes. But we felt like we could bridge that gap with the right partners and approach. And so we kind of started with this idea, and we came to, local county government and some strange partners, which I think gets to some of your iteration and creativity and mashing up different stakeholders and core competencies, but, including Geek Squad as a partner, and thinking about how are we using their competencies and our strengths to come together. But ultimately, that program we were able to do in multiple cohorts. Where we started initially on day one with how we ran the digital navigation program looked very different from where we ended up in a program very aptly named Connect Me DHAD. And we really benefited from learning from and leaning into some of those core competencies of Geek Squad, of our internet service providers, but then our own staff who understood how to engage people and making sure that we were bringing trusted people and resources into their homes so that they could set up that internet access.
Yeah. Oh, I love that. Yeah. A friend and I, or a colleague and I, oh, now they're going to be upset that I took away friend from that. A friend, colleague, and I would, for fun, run this activity called the mashup exercise. And so I love the words that you use, and I love the Geek Squad example, because it's one of those things where it's like, you, as a community-based organization, right? How often are we thinking about our community and intentionally collaborating with them? And that's a little bit of what our mashup exercise does. And uh, I bring that up because Abby and I have run that for our teams before collaboratively. And it's taking, a list of assets related to the challenge or opportunity we're solving for, and then taking another list of assets, whether that's community or otherwise, and pulling one piece from one asset from each pile, reading them together, and coming up with ideas of what of you have a prompt around it, but what that partnership in that example might look like. And so I just love that example of, I don't think many area agencies on aging think about their Best Buy Geek Squad, right? And so I love that. And I think it kind of underpins why it's so important, which I don't mean to be biased, but my favorite discussion point we're going to have is at the very end of the conversation. That was also my catch to keep people on the webinar. But the that is an element of that creative thinking. How do we practically do this within our organizations? How do we practically apply innovation? And the mashup and that example that you shared are great examples of that. So when I think about that question of something that we saw early because we were close to the community, I think a lot about service expansion. As a community-based organization, we do quite a bit of outreach activity. And I think if you take outreach, rather than, as a community-based organization, I think a lot of us do this, but if instead of outreach just being something that you're pushing out to the community, what does it look like to use that as the ears of the organization, right? And I know through conversations of, we have a large contingent of staff that do go out into the community for various reasons. But one of the things that we identified for service expansion was, look, we don't serve all people. right? As a community-based organization with several state contracts and things like that, our services weren't accessible to all, meaning those who maybe could pay, uh, self-pay to participate, weren't able to access our services. And so by having those ears in the community and being really ingrained in the community, we're able to hear that feedback in real time, meaning it takes one of our staff to just go out into the community, right? And just come back to the building and stop by my office and say, this is what I'm hearing, right? And that's a muscle that we've built. And so I'll combine that with, we created this new service for care planning, for care management called Flourish at Home, which so we were responding to the needs of the community of like, hey, I want this, but I can't participate in the publicly funded side of it. Can I still participate? So we created Flourish at Home. And the thing I love about Flourish at Home, Abby, and I'm adding another innovation element, is we also learned from other industries how people are wanting to buy services now, right? Just doing a flat rate for like our reimbursement with on state contracts or things like that, that doesn't make sense when a consumer is coming and saying, hey, I want to self-pay. And so we took a membership model for Flourish at Home. So those were two things that we were able to hear from the community and respond in both ways to that, which I'm really proud of. I'm proud of this team for doing.
I I'm I love that example because we've been thinking about all of the different ways that we interact with people in different settings. So like thinking about that proximity and influencing how we design those things. You have to look at all the different ways that we are able to interact with people and how those needs are going to change at those different interaction points. And I didn't pull a lot of data. I purposely didn't want to like get lost in numbers when we were talking about this, but there is some like scale that I want to paint as I think about this. So we serve 4 counties. Last year, we reached 37,000 people out at community events, just going out, being in the community, being at large scale events, at parades, at fairs. We received 31,000 referrals into the organization and requests for information, just, you name it. 19,000 home visits, just checking in on people in their home, seeing if they're getting the services that they need, seeing if their needs have changed. 16,000 contacts with nursing home residents. So talking individually with the nursing home residents about their care that they're receiving in their facilities and then, it goes on to, 3,000 visits for somebody who's just discharging out of the hospital. So at any given point in those time periods, we're seeing people's needs, people's interactions, their requests for information. And so to your example, how are we using that to say, when we partner with somebody who has a great idea, how are we putting that out to our team and saying, look, we're trying to try something different here. Can you help give us feedback, or can you help us identify, based on the people that you're working every day, how does this land? Do you have someone that might want to participate? And it can go from there, but it is all about how we're thinking about engaging people at each of these individual time periods.
Oh, that's great. And that kind of blends into where we were going to go next with, how does proximity influence the way we design solutions? But I want to piggyback on what you were talking about with the data, though now I feel bad I didn't bring data. That was so impressive, Abby. But I think the data point, I would say our data efforts as a community-based organization very much mirrored our innovation timeline. Meaning like for us, and I think it's important for community-based organizations to understand this, prior to 7 years ago, we would talk as an organization about we 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 have access to incredibly meaningful data, right? But at the time, we didn't have ways of analyzing or interpreting that data, as in we didn't have the infrastructure to make sense of it, right? But one of the things as we started the innovation journey was like, no, no, no. This truly is our advantage when everything you described, thinking about partnerships, how do we collaborate with others? How do we think differently about our programs? How do, like, innovation doesn't exist without those data points on it. And so it was, I've not said that out loud before, until you just highlighted that, but I think our data journey definitely mirrored our innovation journey. What I have said to folks a lot, but now I'm going to bring it all together, is community-based organizations have an advantage because of our proximity, because of the insight that we're bringing in, every data point, those thousands and thousands and thousands of interactions that are happening. Those are all data points that if you look out in the market of entrepreneurs, and I know we have lots of entrepreneurs on the call that are building in this space, what they love about working with community-based organizations is the insight, because there's not the type of market analysis and market research that we have just by existing is tremendous. And so by being able to bring all these things together, it's a great advantage. But that's my long way of getting to this next prompt of saying we lean into proximity in our design process. So when we think about ideation, prototyping, iterating, and implementing or launching, those all require voice of the customer and the person at the center, or person-centered thinking at the center of it. And so when my colleague Erica and I were building a product that we created called Postbook, the ideation was in real time. We were able to talk to individuals that would become consumers of the product in the future. For prototyping, we were able to leverage, one example is our meal sites, right? How do we go and get that feedback early on that a lot of folks don't have that type of access? And so I often describe area agencies on aging and community-based organizations as proving grounds to good ideas, right? Or to ideas and solutions. So I think proximity is absolutely baked into every part of our process of design, right? Because we're leaning into it. And I hope that's what folks on the call here, we had to be it's very easy to sit in a room like I am now and for me to not open the door to get feedback. But the reality is, if I just step out this door, I unlock tremendous insight, right? So for me, I'm trying to encourage a posture change of this already exists around you, lean into it.
Great.
So I love that question. Let's maybe do one more in this section, then we'll move to the next one. And I know when we pre-talked about this, you had some good insight here, but where have larger systems maybe misunderstood local realities?
So when you're talking about like the data and the innovation and kind of that journey mirroring each other, it's like innovation at the speed of data, right? And I think that we've certainly seen complexity and technology coming in and trying to support that evolution. But how people seek information and get information and are able to act on or access information or assistance, very personal, very nuanced. It's not one directional. But I think that there's a lot of conversations around how do we do this at a scale that makes sense for people. But I just know in all of those examples of how those different data points when we're interacting with people, how difficult it can be to engage people all the way through to the point of getting access to a service. So I think there's also a lot of misperceptions about, what happens when we identify a need or we make a referral to a community-based organization. And so I think that there's still a lot of work that needs to happen together, that kind of collaboration or co-creation, even with all of the emphasis that is out there on tools to help streamline this process. We still get examples and anecdotes when people call us for help to say, I wish I'd called here sooner.
Yes.
And that's never something that we want to hear when someone needs something or is in a point of crisis or, has a long journey to get access to what they need. So even with all of the feedback loops, there are, I think there's just perceptions around when I make this referral, I know exactly what's going to happen. That in and of itself is, there's so many opportunities for collaboration, iterating on that process to ensure that, we're coordinating all the way through the barriers from like a warm handoff to, a one-on-one interaction to going alongside of somebody to assist. It's a very personal process and we need to use technology, but also that one-on-one or that person-centered interaction to make sure that people are getting where they need to go.
Absolutely agree with you, Abby. I had a conversation a couple weeks ago with um, a group who was looking to build a new home safety accessibility technology. And I was really grateful to be asked to be an SME in their design process as they were kind of figuring out, okay, what should this be? So this was very early stage, but um, I was sitting with this group of designers and builders, and we were talking about, how can technology accelerate like this, uh, accelerate, uh, fall risk prevention, right? And how do you utilize an OT in that process, but how do you leverage technology in that as well? And this group and others have thought from a technology first perspective, right? And what where I think it's really important for community-based organizations to participate in this work is, I think when a lot of folks on the call heard me say like there was a technology first component, if you're in the OT space, you know that a phone camera taking pictures or video is only going to catch so much of what might be a risk factor in safety and accessibility in a home, right? And I went even a step further to say it doesn't capture the smell of a home, right? Which is something that an OT is able to help identify where some of these risks are. So when we think really broadly about, optimizing health and things like that, and we talk about these really big things, it is great and we should continue to create, but it's also why it's so important for community-based organizations to be intentional about talking to non-traditional folks, to talk to product designers, to to fight for their way to have a seat at these conversations. Because I promise you, the insight, I'm not the smartest guy, right? I'm I'm not a home safety and accessibility expert, but being on that call, I was able to give enough because of what my colleagues have shared with me to be able to articulate, hey, think about this, think about this. And so I a lot of times, Abby, from my position, think about it in like the new product space, right? Because we find ourselves at the intersection of working with a lot of entrepreneurs that are looking to prove their ideas and things like that. And so that's one of the things that we've really honed in on is help be that voice at the table, to understand, hey, actually, this is what it looks like in the home, and this is what so and so's last visit looked like. They ran into this scenario, this scenario, this scenario, and give designers that really hard challenge to figure it out. And if they can figure it out, that is going to have such a more sustainable and scalable impact than if they had not considered it. So that's how I like to think about that question. So for the sake of time, we're going to keep moving. We're going to move on to the power of collaboration. So proximity gives us clarity, but no single organization can carry the weight of social care alone. And Dustin did a great job of articulating that in his intro. So I'm going to repeat a little bit of what he said, that the needs of older adults, people with disabilities, are interconnected. Health, housing, nutrition, transportation, and caregiver support overlap in real life. Yet our systems often separate them, right? Funding structures and performance metrics can unintentionally drive competition instead of coordination. True innovation in social care requires us moving beyond territorial thinking towards ecosystem thinking. Collaboration is not just about MOUs, memorandums of understanding. It's about shared incentives, shared data, shared accountability, and shared outcomes. So we're going to explore what it really takes to build unified systems. That's a big statement. I don't know that we're going to figure it all out on this in this small fireside chat, but how to build those unified systems of support that function as a network rather than a collection of silos. And we're going to start with this question. And I think Abby and I are going to talk about this in some shared ways and different ways, but what barriers keep organizations in competition rather than collaboration?
I think so. Something that we try to address, and I think we do it in some of the forced partnerships, or maybe the forced mashups that we may have with some of our contracts or our partner vendors. But sometimes I see a barrier around this perception of duplication. Like, well, what are you doing, and how is that different from or not of what we're doing in terms of trying to do care coordination or that one-on-one assistance? Why do we need a care coordinator at this organization and that organization? And and we've seen this in some of our partnerships and our healthcare payers who have different vendors that focus on different things. And it's just been our observation that there is no one approach or answer to partnering or contracting with different types of providers or vendors that may be going into homes and focusing on accessibility or focusing on chronic disease management. That can be a right approach, or it might be an approach where there's a single partner that's taking a very kind of generalist, person-centered, we're going to help connect you where you need to be. But I think our observation and our lived experience is that there is enough work to go around. And instead, so then let's focus on how we're collaborating, or we're extending the gaps between partners, even if the word coordination is used, between both of us. How are we effectively sharing data to work together? Again, that innovation at the speed of data. How are we, seamlessly making that happen between partnerships and in standard processes? And how are we prioritizing the right service at the right time? All of that can happen, I think, effectively when we let go of competition and understand that we are kind of good extenders between different partners and different collaborators.
Oh, that's great, Abby. And I wrote down just because I didn't have a highlighter to highlight it, but I put stars all around it. There's enough work to go around, right? And I think that's moving from that mindset of we have to be territorial over all this, but I think that mindset shift opens the door to actually how can these systems work together? How can, and I know we'll talk about it here in a little bit about data and aligning on that. There was a perspective I wanted to bring. We here in Indiana, and I think other communities across the country probably feel this as well. If you're in a nonprofit community-based organization, I think you're seeing a lot of funders starting to incentivize that collaboration, right? That if it's kind of a spectrum of collaborating to merging, right? Like they're incentivizing everything across that scale because they see from their vantage point, yes, there is enough work to go around. And these unique organizations express something important to their community, right? And fill an important community gap. But rather than viewing that as a territorial, there should only be one, you're seeing a lot of this incentivizing through capital partnerships. And so rather than me going to fundraise for a specific program that myself and CICOA are going to wholly own, a lot of these funders are looking at this and saying, well, how do you and you work together to make this happen, right? Because and sometimes I grumble like, oh, but we're different. And it's like, no, the vantage point is correct. They have a different view of the community that's seeing this dot connect, and they're putting their incentive behind that. And I think once I get past my grumbling on we should get it all right, I see the point, right? And I see the value in that. So I would encourage community-based organizations to think about how does their local community foundation or how does a philanthropic funder in their community think about partnerships, right? And I think if you haven't had a conversation with your local funder, you should go and have one. But more importantly, you're going to see on their rubrics who are the partners with you on this, right? And if I were to add, I want to add one more thing to the philanthropic side of this. Philanthropy can be a superpower for community-based organizations to advance innovation in a way that others cannot, right? So leverage that insight in community with partners. Be open about it. I think most folks that you would talk to that know me or have collaborated with me and collaborated with CICOA, we hold things with a very open hand of like, how might we be able to do this together, right? And so I think leaning into that, demonstrating that to philanthropic funders can unlock some practical support, tangible support to advance whatever that creative response is that you're pursuing. Abby, let's end this section with this question, and I'm really interested in your perspective on it. Where have you seen collaboration, whether it's with payers, because I know in Ohio you have great relationships with payers and things like that, but even outside of that, where have you seen collaboration unlock outcomes that would not have happened alone?
But I don't know how often this happens, but we've had great examples and partners where a lot of times the focus on contracting is on a very specific or a very defined healthcare outcome. Are we reducing readmissions? Are we reducing utilization? Are we hitting certain quality measures? But we've also in partnering and in being good partners and trying to be creative had some payers, health insurance companies come to us and say, we're really concerned about this population. And sometimes that population is a type of community-based provider, or their membership, caregivers, and saying, we're really concerned about how this population is going to respond to this change in programming, or changes in resources and access in the community, but we're not quite sure what to do about it. What do you think? And to have someone come to us and say, like, what do you think, opens the door to us going back to, the proximity and all of the interactions and touch points that we have, and say, okay, this is what we're seeing. Maybe you're seeing concern for this type of provider, but we have a way to support, the individual by putting this service in place. And so how can we think about internet access in homes in a creative way that's going to support the provider, the independent provider, but also going to support that member, that individual in the home that's receiving the service. It definitely goes beyond some of the traditional quality measures that we typically focus on in our healthcare contracting, but it's allowed us to create alongside of that healthcare partner to provide a new service to their members.
So I think it's interesting. It goes back to this posture perspective and this mindset. For a community-based organization to get to the table or to have the question asked of you, what do you think? Right? To me, this is the thing that community-based organizations at their worst can have like a tunnel focus of this is what we do, these are the services we offer, and not have a posture of having community very broadly, right? In your example, payers and otherwise, I think it's really important for community-based organizations to build that muscle of how do we posture ourselves? How do we present ourselves in a way where it's like, yes, the community can come to us and say, what do you think? Right? And I'll say on this question, Abby, in the last 5 or so years, we've been really intentional at CICOA about broadening who it is we're doing outreach to and having, I can't remember if Dustin said it earlier, hey, this is going to be a strange conversation, or he's said a word like that, or you did, Abby. But and it almost sounds like the start of a joke, right? Like, what do you get when you have a venture capitalist and a occupational therapist and a, I don't know, whatever I am, a VP of innovation at the table? But we've built that intentionality to go and have those conversations with the community. And again, for those of you that are listening, if you're taking a note, I think this is a really big point. Do some intentional outreach with folks that it may not make sense on the surface of why you're going to reach out to them or why you're going to have a partnership meeting with them. But for us, and we've not seen the fruition of this yet, but to that example I was sharing earlier of what do you get when you have like a venture capitalist and an OT at the table, it starts to unlock some things that we would have never thought about independently, right? And we put some specific challenge statements up with some folks like this to get their perspective on how they would respond. And it unlocked, Abby, insight that we would have never thought of alone, right? But it took diverse thinking. It took divergent thinking. So that's a lot about what we talk about when we go through that innovation journey of how do you do divergent thinking well? Part of that is getting a lot of diverse voices and perspectives at the table around a specific challenge or opportunity. So that's great. All right. We're going to keep going here. We're going to talk, this is kind of our second to last section before we get to the Q&A on this, but we're going to talk a little bit about a national perspective, local impact. So we've talked about what happens up close. So let's zoom out and consider the national currents shaping this work. So social care is entering a period of rapid transformation. Value-based care models are accelerating, expectations around data sharing and outcomes are increasing. Technology, including AI, is entering care coordination workflows. Federal and state policy are evolving. At the same time, the work remains deeply local. Every trend lands differently in every community. The opportunity and the tension exist simultaneously. So we want to take a few minutes to reflect on what is emerging nationally and how those forces are shaping the daily reality of community-based organizations. And Abby, was so funny when we were planning this this Envision together, you had sent me an email of, hey, just thinking about you, how are you? And it was one of those days where we were living here at CICOA in that tension of policy change and all of that. It was like, well, I can't say all this in an email. I'll write a novel. But I thought that was funny. So, Abby, what national trends are you looking at most closely right now?
I mean, I think there's always a few. We're looking at who else is talking about innovation and aging at the same time, and I think there's interesting stuff out there around caregivers. What is the role of the caregiver, and how is that shaping what we're thinking about in terms of programming and services going forward? But another aspect is thinking about our workforce and retirement, and what is right sizing retirement. Are we as an organization or a company thinking about and budgeting for how do we welcome alternative work schedules to be able to bring in, either maintain or bring in different perspectives through part-time or contract, but retaining some level or accessing some new level of expertise that would normally, be thought of in a very kind of black and white way: retirement, volunteering, or contributing. Um, we talk a lot about wealth management and generational wealth, and how are we supporting people to plan for and think about their needs earlier on. And that goes across all income levels. If we can get everyone thinking earlier on about needs and planning for the future, what does that do to your individual prospects? And so thinking about that and financial planning as, the front door to social care or long-term care planning, we would love to be thinking about and moving and organizing in some of those spaces.
Yeah, absolutely. And I think it's really important, and I think everyone's hearing this a lot, and not to be a one-trick pony, but community-based organizations are right at the center of that work, right? And that front door. Um, so the insight and all of that on that trend is, I think, has such actionable elements for community-based organizations to think creatively. I think for us, you said it as well when we think about caregiving. So I know one of the friends we have on the call, Christopher, is, he's doing a startup in the caregiving space. I've helped launch other caregiver startups, and CICOA's got its own. It kind of, Abby, to the point is there is not going to be enough solutions for the family caregiver in the market. And so we look at that a lot at CICOA to see how can we continue to respond and continue to create um, in the space is a very big deal for us. So not that we're not focused on other areas, but family caregiving is such a large piece of where we see creative response can occur. Okay, Abby, last question on this section or last prompt on this. Um, where do you see innovation moving faster than readiness?
So this is perhaps a non-exciting answer, but data standards.
Yes.
How are we defining community service data? What is a meal? What is a transportation ride? Or I think, and I think we've talked about it. We certainly talk about it internally about, what we could do if we spent less time moving data from place to place. And so we have to get better at defining our data in a way that will allow it to seamlessly transfer. And I think, there was that commercial back in the day of, there's a code for that, from a healthcare perspective, there's a code for that, think of some wacky off the wall reason. And I think there are times where we need a code for that, but also adding those codes adds to complexity. So, there's a balance that we're going to need, or I see us needing to straddle, but we need more local voices when it comes to how we're thinking about how do we characterize, categorize, and share the different data fields that we're working in every day.
And I know we have some of our friends from US Aging here. I think that is where we as social care entities, and for those of you that are an area agency on aging, continue to raise our hand to say, yes, like we want to continue to advocate in this space. Because I agree with you wholeheartedly, Abby, that that data, those data standards are going to unlock so much untapped potential and freeing up resources in such a big way. And so it kind of goes to that local versus national advocacy effort, right? Like this is an important place for social care organizations for us to really accelerate innovation, those data standards and those work groups that are happening. We need to continue to advocate for our representation, right, on those committees and those work and that work. And continue, I'm always biased towards continuing to create in the space that pushes the moves the needle, right? So create those things that help inform that standard. That's another way of advocating and demonstrating the good work. Okay, our last section, and then we'll get into Q&A. And this is the section that, Abby and I have spent quite a bit of time talking about, and you've seen elements of it throughout the conversation today. But it's how do we foster a culture of creativity and hope within community-based organizations? And so systems evolve when leadership evolves, and innovation is not only strategy, it is culture. So community-led systems often operate under constraint, right? Workforce pressure, funding complexity, rising demand. Sustaining creativity in that environment requires intention. You've heard that word a lot today. It requires leaders who create psychological safety, who give permission to experiment and who reinforce mission clarity even when outcomes are uncertain. So hope is not abstract, it's operational. It shapes how teams approach problems and whether they believe change is possible. So we're going to reflect a little bit on how to cultivate creative confidence and resilience within organizations that are already carrying so much responsibility. And we're going to start with, how do you foster creative confidence within your teams? And I'll start this one, Abby. And creative confidence starts with an intention. But when we were talking, Abby, yesterday, or the day before, we talked about like those first 5 minutes of a meeting, right? And when I got to come out to Ohio to spend time with you all, I don't think I went fully weird. So maybe it's a better comment to my colleagues here at CICOA. I often try to be the weirdest person in the room, Abby, to give permission, right? And I try to set that standard in the first 5 minutes with intention, right? So I often lean into um, not icebreakers. I don't like calling them that, but I often lean into some sort of how are we going to activate this creative muscle and give permission right out the gate to think creatively? Because Abby, I absolutely believe that all of our colleagues' work and everyone who's on this call are creative, especially if you work in the social care space, especially if you put person-centered thinking at the forefront of your work. That is creativity in motion, right? That's our colleagues are doing creativity every day. But then you kind of get into a meeting where you're talking in, not that this isn't a nice room, but very sterile walls, right? And it's like, ooh, the dynamic has shifted, right? That mindset of creative response suddenly has all this pressure on it in a meeting. And so what I try to set that stage for is being very intentional with exercises typically at the start to activate that thinking. And so one of the activities we do quite a bit is called the 30 circles exercise. And friends, it only takes, I think, 3 minutes to do it at the start of a meeting. You give everyone comes to the table with a piece of paper, draw 30 circles, start the timer for a minute and a half, and ask people to create as many recognizable shapes or objects out of those circles. And I think, Abby, you and I and Jessica did this at the US Aging Conference, and it was a lot of fun. But out of the gate, it opens up this like we are going to think differently. And so I always participate in that activity with folks. I draw absurd things, even though it's the 100th time I've done that worksheet. But what I'm trying to do is set a tone and set permission to think creatively. Now, we also do some other intentional things. It's not just me being a goofball for the first 5 minutes of a meeting, but we do we practice intention about encouraging ideas. So sometimes it's me, I'm not crossing a line in a bad way, but saying a very absurd thing to give folks permission to go up to that line, to think creatively, to think out of the bounds. We also, Abby, I like highly structured meetings, which some of my colleagues, I'm glad their video isn't on because they'd be like, no, you don't. But I like structured meetings in that I like it when folks raise their hand so everyone around the table has a voice. We try to create those ground rules of making sure voices uh, can exist and everyone's voice can exist in the room and creating that sort of space. So those are a couple ways, Abby, in which we think about it. And I love that you and I have been able to do that together some as well.
Well, and that's why I've got my pen and my paper, because you you need those pauses or those reminders. Because even as I was preparing for this and trying to think about, well, where are we innovative? It just is kind of, you can get stuck and think about, no, I'm not. And the one example that I do think about a lot is about, about COVID and our time during the national emergency. And I'm not trying to be controversial in saying I want to go back to the pandemic. I don't, but it was a time for iteration and innovation in response to a national crisis. We had to row as an organization in the same direction, and I think this, national emergency or not, we have a staff that's mission driven, and they want to be there to serve the mission. And when the mission can get interrupted, you have to change how you do that. And so we achieved some amazing things in a very short time period. We had new programs, we had new contracts, we had new services, we had new processes in the matter of months. And so how are we harnessing this without a uniting national emergency? It's those pauses, like what you talked about. It's the, tapping into people's commitment to the mission and iterating so that they can get back to spending more time with a community member by, creating more time in their schedule or thinking about something that we can do differently.
Abby, one of the things that I loved in our work together was when I was able to come out to Ohio for one of your strategic planning retreats, you had a cross section of your entire organization there, board included, right? And I think that's a really important element. And it actually came up in a strategic planning session we had, I think last week, was how do we set expectation around, taking taking risk, adjusting our strategies and things like that. And I think when you include the board and all the way through the organization, you're setting this expectation, right? Like innovation, especially within a community-based organization, needs that total buy-in to actually work, right? Because if the board's not bought into it, then it's really hard for the practitioners of the work, the staff, to go and execute on where it is we think we need to go. And so I did want to highlight that I think you, in those sessions, when you're intentionally talking about innovation and what that is how your staff and you are defining that, and having your board bought in and co-creating that with you, I think unlocks so much. And I think it's an important lesson for all social care entities. Because Abby, you and I talked a lot about, okay, how did we get to this point at CICOA? And it took a while, right? It took us getting buy-in at every level of the organization. And so for organizations that are thinking about flexing this muscle and investing in it, I really think your board is cannot be an afterthought in that exercise. I did want to say, we weren't using Microsoft Teams, Abby, before COVID. We had no idea what Teams was. And then COVID happened, and it's like, oh, we have this thing in Microsoft that we might need to utilize, and spun it up in the matter of, a couple weeks as we all transitioned home. So that's hilarious. All right, let's kind of merge some of these questions together here as we start to come to an end. These two questions had to do with, how do you create, or what does psychological safety look like in a mission-driven organization? We kind of touched on that. And then how do you protect hope by maintaining accountability? And I'm going to take a quick response to this to say, I think community-based organizations one of the biggest struggles that I've experienced recently is we just spent an hour talking about this incredible insight that we all have, right? And our closeness. And guess what? The market isn't always ready to respond to that insight, right, Abby? Like, let's caregivers for a second. One of our new solutions called CareWare Journey is a solution for employers, right? And we're looking to, do one-to-one coaching with employees and provide them with caregiver education because we know all the data around the impact of being a full-time family caregiver and working. But that conversation, though we have all the data, Abby, that's not really a mainstream conversation yet, right? Employers aren't necessarily thinking about it as much as we're thinking about it. And I think that is where I think it can be really frustrating as a community-based organization. We have this tremendous insight, and then we pair it with excellent response, but then we realize, oh, are we too early, right? And I think it's really interesting uh, to think about how that fills into our marketing efforts as a community-based organization. I was just at a conference and it was talking about uh, caregiving showing up in movies and television shows now, which is indicating this mainstreaming acceptance of this is it. But um, I'll say in response to that, Abby, that doesn't change our work. We're still going all in on that because we want to be on the leading edge of those solutions. But it takes an understanding board, an understanding executive leadership to create the space to say, you know what? Being early is an advantage, and we're going to figure out how to get there, right? And how to get there is going to be different for every solution in every circumstance, for sure. But the acknowledgement of board, executive leadership, and the team and reinforcing we're on the right path. We're on the right path. I think those words go so far for building this muscle and reinforcing it for community-based organizations.
Yeah, as you were talking, there are times where we'll have a conversation and there's also that moment sometimes where you're like, if this is our idea and we know it's needed, there's sometimes also that what can we do that's within our control? So there's a couple of different things where, at Direction Home, because I won't say because, but innovation looks very similar to improvement. And at Direction Home, each of our job descriptions has a clause, and it's not duties as assigned. It is specifically called out that staff have a responsibility to improve their job on the day-to-day.
Oh, wow.
And so, and we do that through standard quality improvement practices, Lean, Six Sigma, but it is understood and it's written in every job description that each person is to look at their job and work to improve their job on the day-to-day. And sometimes not all of that's within our control, but it's still their responsibility to look at and think about and bring these things up and bring it to leadership and say, this may be dictated to us, but it would be so much better if we could do X, Y, and Z. And so there's the push and pull of what's within our control, and let's work with what we can within our control, but then continue to push. And a lot of times that insight to push is going to come from staff. It's not necessarily going to come from my insights or my day-to-day. And so needing to really take that time and respect that when people come together with an idea or an improvement, how are we responding as an organization? How are we collecting that? How are we providing feedback? How are we evaluating what we can move forward or saving this for another day, but knowing that, we're looking at it.
Abby, I thought I knew about all the cool things you had at Direction Home, but that line, I hadn't heard that before, and I think that's an incredible shift in perspective uh, about, in that job description to have a responsibility to improve this position, this work. That that's incredible. I love the framing of that. So thanks for hiding it, but then sharing it with everybody.
Well, and I can't take credit for it. I
Yeah.
really I inherited an organization that has incredible corporate culture, which is probably a whole other Envision session. But there's a lot that we can do when you have a wonderful culture that you work with.
Right on, right on. Well, Abby, before we get to the Q&A, was there any anything that we didn't cover that you for sure wanted to make sure you communicated with this group, or that you and I, uh, something that we didn't discuss that we needed to, or anything that you want to say to kind of sum up your perspective on this Envision lecture?
I know sometimes I'll go to sessions or I'll go to a conference and I'll think like, we would never be able to do that. And I think you then have to give yourself the credit to go back and look at how you as an organization or a leader has changed in the last 10 years, 12 years. I can think about what's changed at Direction Home just in the last decade. Funding has shifted, populations have shifted. Everything starts from somewhere. And so, one of the things that I appreciate about our partnership and working with, there's tangible things that you can do. And if it's starting with 5 minutes at the top of a meeting and saying, what if we could, what if we were able to, or how might we do this? A lot more is obtainable than just sitting in a session and thinking, I don't know where to start.
I would say something similar, Abby. Though I get maybe a little bit more pushy, and I don't know if I was ever this way with you, Abby, starting 2 years ago. I am super optimistic and maybe a little pushy on the fact that community-based organizations have this advantage, right? They have this advantage of proximity and insight. And I think you bring up a great point. Sometimes you sit in conversations, you sit in sessions, and it's like, how do I bring this back, right? Like, how do I do this? And I think for for me, and I think for you, Abby, when we kind of created this innovation journey, we took best practices, just like, when you talk about that culture element, you didn't do that alone. Well, some of these things that we talked about, the mashup exercise, the 30 circles, those are things from great design companies like IDEO that they use with their corporate clients, to push this work forward. Same thing with Lean, Six Sigma, and human-centered design thinking. All of these things come from, we don't do this alone, and we didn't create this alone. However, this this push on accessibility that I started the time with, I think is so important, because I don't think anything that we illustrated today or talked about today isn't something that can be taken to an organization. So much of it is mindset, right? So much of it is posture. So much of it is, saying, can I block off an hour of my calendar and go meet some different people in the community that I maybe haven't met before? That's another exercise that I do. Abby, I don't think you and I have talked about this one, but is, if you're driving into work, um, take a different route to work that you've never taken, right? Because your brain fills in so many details when you take that same route to work. But especially for those of us that work in community, right? Take a different way to work. See what other organization you don't know about or new business has popped up. Stop, right? Go and see them. Have some of that practical stuff that we talked about. Have that conversation. Maybe one thing I alluded to was, but didn't click into, was developing challenge or opportunity statements, right? Like being able to have something that you're responding to and can invite others to respond to. And so what we will do after this, and I'm going to have Cassie come off mute here in just a moment, um, we'll have this recording sent out to you. We would love for you to share it with your teams and other community-based organizations and partners. We would love for you to share it in that way. Abby and I will also include information on how you can contact me from a wrinkle perspective and how we might be able to collaborate. We'll include Abby and Direction Home's information in there as well, as we all look to figure out what does collaboration in social care and innovation look like. We'll include all that information. I'm looking to see if I'm missing anything else. Before we turn over to the Q&A, I did want to say a couple last thank yous. One, I want to thank Anthem again for their generous support for the Envision Lecture series and ensuring underwriting to make this happen. Abby, I want to say thanks for investing the time and preparing for this fireside chat and for the conversation that you and your team have put towards this. And I want to thank CICOA's team for their work in putting this together as well. So with that, Cassie, are there any questions or comments from the chat that we can respond to in the final 4 minutes?
Yeah, absolutely. We'll try and be a little quick. There's some great conversation in the chat, responses to some of the things you were talking about. So wonderful. Thank you everyone for participating. Thank you again to Jonathan and Abby for leading this. It's been a wonderful conversation, and I know it will continue. So we will send some contact information and some more information about this recording to everyone who registered. I want to pull out, we have 2 questions in the Q&A, and maybe we can give them each maybe a 60-second answer so that we can get to both of them. So Karen asked, when thinking about innovation, how do you attract people with lived experience to be part of your beta testing? So those, free to early adopters, current clients, and so on.
Oh, that's great. Abby, I'll let you go first.
The
You're
wild
welcome.
card. No, it's I think that it has to be part of the practice of like, we have this idea, but we need real feedback. And I am guilty as a leader of, saying, I've got this great idea, but my great idea might be a terrible idea for somebody else. And so we have team members that have been really fantastic about going back to their team and saying, all right, how can we get some of this information? How can we ask this question more directly to our community members? I think we could go a step further and say, as we're going down the journey of creating a new program, how are we engaging them ongoing in that conversation? But, really trying to be intentional of knowing that everybody is busy, but if there's an opportunity when we're having a conversation with someone on the phone, can we wrap that idea into that conversation, that screening or questionnaire?
That's great. I will respond quickly to say, Abby, I was somewhat prepared for that question. I'm so sorry I threw it to you right away. I will own that, and I owe you for that one. We get to prototype really quickly with intentionality, right? And so I've got a copy of Postbook here. This was something that in that ideation, prototype, iteration, implementing, launching phase, however you want to describe that, getting to prototype gives something tangible to somebody to respond to. And to answer that question that was asked, clarity in what we're asking for attracts people, right? And so for Postbook, we were testing intergenerational connection. So we gave this to all of our staff to go and then partner with somebody who was not a staff member to do Postbook with. And so that was a very quick example of having something tangible and then being able to articulate that tangible thing and what you're looking for from somebody in response is a great way to attract people. Cassie, even though, can we go 1 minute longer with one more question?
Yes. We'll go another minute or two. I know some of you have to hop off, but again, it's recorded. So last question before we log off for today. From Christopher, given that both of you importantly sit in the middle of care with payers and providers on one side and patients and caregivers on the other, how do you manage the demands of each constituent? How do you determine the projects and the opportunities that you want to pursue?
I need more than 1 minute.
I do. Yeah.
It's
you know, tough.
Yeah, that it is really tough. And I want to give that more full thought. So I can't remember who asked that, but please put their email in the chat because Abby and I can take more time to respond to that. I think for me, my quick answer is our organizations and community-based organizations can serve a convening role. Like that's in our DNA to serve as convener. And so as a community-based organization, you have to add some intentionality behind that, right? To get all the perspectives out on the table and all of those stakeholders at the table. But for me, and my quick answer is that convening element is part of our DNA, right? And the prioritization gets really tough. I think that's where I'm struggling a little bit in that answer. And I take it on we handle it kind of on a case by case basis. So, Abby, what's your perspective?
It is tough. I feel like that's where we lose the most time is when we, struggling over making those decisions on what we move forward. But I've got some great folks on my team who do have those prioritization matrix, the skills and the tool, experience with the tools to try and drive us to a more standard decision-making process. But it's hard because each situation is unique.
Yeah. All right. Well, with that, we will be in touch via email with follow-up information and with future Envision lecture dates. We thank you all for spending this hour and a half with us. Thanks for sticking it out with us, and we look forward to connecting with you soon.